If your MRI is showing partial or complete PCL injury, what does that mean? We see this is our knee joint. This is the front part of the knee joint and this is the back part. This is the thigh bone and this is the leg bone. Now there is a very strong ligament between these two bones. As you can see here, this ligament here. So this ligament here is known as PCL or posterior cruciate ligament. Whenever there is an injury to this ligament, it is known as PCL injury. In PCL injury, there is an instability between both the bones, the thigh bone as well as the leg bone. So if there is a complete PCL injury, then this bone tends to move backwards on this bone. So this leg bone tends to move backwards, especially when you are trying to climb down the stairs. Now this PCL injury is very common in while playing basketball or baseball or during skiing, or when there is a complete knee dislocation. At that time, this PCL injury might be associated with other ligament injuries also. Normally, this is a very strong ligament, almost 1.5 times stronger than ACL ligament, anterior cruciate ligament. So if there is an injury to PCL ligament, don't worry. First of all, take rest, have anti-inflammatories, put ice over it, and within 3 to 4 weeks, everything will settle down. Now, if you are going for an MRI, then your MRI might show a complete or partial injury. If there is a partial injury, then treatment depends on age and the activity requirement of the patient. Normally, partial injury can be very well treated with medicines and rest initially, followed by physiotherapy. However, if there is a complete ACL injury, then surgery is required, because if surgery is not done, then there is a persistent instability in the knee, which leads to early osteoarthritis. So if surgery is required, these days we do just arthroscopic surgery, which is done through small incisions only. We recreate or reconstruct this ligament here by making tunnels in the bone, and everything is done through small incisions or arthroscope only. It's almost a 1 hour surgery, and after the surgery, patient can be discharged home the next day. PCL injury in itself can be managed very well. So if your MRI is showing PCL injury, and you have difficulty in walking or there is instability in the knee, don't worry. Visit your nearest doctor, and depending on the extent of injury, whether it is partial or complete, your doctor will advise you treatment accordingly. After surgery also, the results are very good, and within few weeks or few months, you will be back to sports again, where you can play basketball, baseball or whatever you want to play. Thank you. अगर आपको हमारा ये वीडियो पसंद आया तो हमारे चैनल को सब्सक्राइब करना ना भूलें और ज़्यादा से ज़्यादा शेयर करें।